I see this question constantly in RMT groups. Someone will post, how do I treat someone with PTSD differently than someone who experienced childhood abuse or a trans person who's experienced trauma? What do they need that's different? And here's what I notice. The person asking genuinely cares. They want to help. But there's this underlying assumption that different types of trauma create different presentations, different needs, different treatment approaches. And that assumption is wrong, and it's costing you. It's costing you clarity about what your patients actually need. It's costing you confidence in your scope of practice. And honestly, it's costing you your energy. Because when you don't understand what's actually happening, you end up trying to fix things that aren't yours to fix. Today, I want to clear this up. Because once you understand what trauma actually does, regardless of where it came from, everything changes. Your intake questions change, your touch changes, your ability to stay present with your patient changes, and your burnout gets a lot better. So let's start with the confusion.
I'm Jamie Johnston, and you're stepping into a new era of thriving as a massage therapist. We're embracing who you are, pursuing what you love, and confidently shaping your practice. We'll challenge industry norms, spark change, and discuss what truly matters. Things like mental health, evidence-based practice, and some topics we've long avoided. Let's create better outcomes for our patients and happier, more fulfilling practices together. Welcome to the New Generation Massage Therapist Podcast.
Here's what I think is happening in our profession. We've been taught to think about trauma in categories. Things like combat trauma, childhood trauma, medical trauma, relational trauma, sexual trauma. And the implicit message is these are different things that need different understanding. So when a therapist encounters a patient with PTSD from combat, they think one thing. When they encounter someone who experienced childhood neglect, they think another. When someone mentions that they're trans and have experienced discrimination and trauma, they think yet another. And the result? Confusion and paralysis. Therapists second guessing themselves about what to do or say. But here's what the research actually shows. The source of the trauma is different, the story is different, but what happens in their nervous system? Well, that's remarkably similar. And that's the thing nobody's talking about. Because if you understand what trauma does to the nervous system, if you understand the actual mechanism, then you stop asking, how do I treat PTSD differently than abuse? And you start asking, what does a poorly regulated nervous system need, regardless of how it became poorly regulated? That's a completely different question, and it changes everything. So let's talk about what actually happens when someone goes through trauma. Excuse me. When you experience something genuinely threatening, whether that's a car accident, childhood abuse, medical trauma, discrimination, or combat, your nervous system does exactly what it's supposed to do. It goes into protection mode. Fight, flight, or freeze. Your body floods with stress hormones. Your threat detection system gets turned up to maximum sensitivity. Now, normally, once the threat passes, your nervous system settles back down. The threat response was useful, it kept you alive, but then it turns off. But sometimes it doesn't turn off. And this is the key. It doesn't matter why the threat happened. It doesn't matter if it was one big event or years of similar ones. It doesn't matter if it was physical, emotional, or relational. What matters is that your nervous system got locked into a state of threat anticipation. The research shows us what this looks like neurologically. Your brain gets stuck making hyper-precise predictions of danger. It becomes hypervigilant. It's constantly scanning for threat. And because it's stuck in that mode, it filters out safety signals. Someone touches you gently, and your nervous system interprets that as a threat. You hear loud noise, and your body floods with adrenaline. You see someone who reminds you of the person who hurt you, and your whole system goes into protection mode. This is called central sensitization, and it happens across all trauma types. The nervous system becomes sensitized to threat. It's like the volume on your threat detection system got turned up, and nobody knows how to turn it back down. But here's what's important. This isn't a choice. Your patient isn't being dramatic or overreacting. Their nervous system is doing exactly what it learned to do. It learned that the whole world isn't safe, and now it's protecting them the only way it knows how. The research also shows us something else. People with trauma histories often have lower cortisol levels, which sounds backwards until you understand what cortisol actually does. Cortisol's job is to put the brakes on your fight or flight response. Lower cortisol means weaker brakes. It means a nervous system stuck in activation, struggling to downregulate. So you get this picture, a nervous system that's hypervigilant, hypersensitive, and struggling to calm itself down. And it looks the same whether the trauma came from combat, or childhood, or discrimination, or medical events. That's the mechanism. That's what's actually happening. Now, here's where it gets practical. Because once you understand the mechanism, the question becomes, what does a nervous system in that state actually need? And the research is clear. After trauma, people need 5 things. Not 5 different things depending on the trauma type. 5 things, period. And the first one is safety. A nervous system stuck in threat mode needs evidence that the world is safe. Not intellectually, neurologically. It needs to feel safe. That's why your presence matters. That's why your touch matters. That's why the environment you create matters. You're giving their nervous system a safety signal. And the second is calm. A poorly regulated nervous system needs help calming back down. Not forced relaxation, not toxic positivity, but genuine regulation, co-regulation. Your calm nervous system can help regulate theirs. And the third is connectedness. Trauma is isolating. It creates shame. It creates the feeling that something is wrong with them. Connectedness, genuine human connection, being seen and understood, is literally healing. When someone feels truly heard and understood, their nervous system gets evidence that they're not alone in this. And fourth is self-efficacy. This is the sense that they have agency, that they can do something about their situation, that they're not helpless. Trauma takes this away, and healing requires getting it back. And fifth is hope. Not false hope, real hope. The understanding that things can be different, that their nervous system can learn something new, that healing is actually possible. And these 5 things, they're not trauma type specific. A person with PTSD from combat needs them. A person who experienced childhood abuse needs them. A trans person who's experiencing discrimination and trauma needs them. Someone recovering from medical trauma needs them. The how might look different. The conversation might be different. But the what, the actual needs, that's the same. And that's the clarity that changes everything. Now, I want to talk about something else that gets confused with trauma all the time: stress. Because here's the thing: stress and trauma are not the same. And understanding the difference changes how you work with your patients. Stress is a normal response to a demand. You have a deadline. You have a difficult conversation coming up. You're worried about money. You're recording a podcast that you hope your colleagues will like. Your nervous system goes into activation, and that's appropriate. That's useful. And then the stressor passes, and your nervous system comes back down. But trauma is different. Trauma is when your nervous system gets stuck in that activation. When the threat is past, but your body is still in protection mode. When your threat detection system stays turned up even when you're safe. And here's what's important. A lot of people think they have trauma when what they actually have is chronic stress. And that matters because the treatment is different. With chronic stress, you need to address the stressor. You need to reduce the demand. You need to create space. You need rest and recovery. With trauma, the stressor might be gone, but the nervous system is still stuck. So rest alone doesn't fix it. You need your nervous system to learn that it's safe again. You need those 5 things I mentioned: safety, calm, connectedness, self-efficacy, and hope. Now, here's where it gets tricky. A lot of people have both. They have an old trauma that's still affecting their nervous system, and they're living in chronic stress right now. So their nervous system is dealing with both the activation from the past and the activation from the present. That's why they feel so exhausted. That's why they can't seem to recover no matter how much they rest. That's why a vacation doesn't fix it. As a massage therapist, you're in a unique position. because you can help with both. You can help reduce the activation from stress through your touch and your presence. And you can help create the conditions for trauma healing, safety, calm, and connection. But you need to understand which one you're dealing with, because the approach is slightly different. Now, I want to talk about something that's not being discussed enough in our profession, and that's vicarious trauma and burnout. You've probably heard therapists call themselves empaths. I'm personally not a fan of the term, but if you want to use it, go ahead. And I understand why they use it. They're trying to describe something real, the experience of absorbing their patient's pain, of feeling an echo of their suffering, of carrying their stories home. And here's what I see happening. Therapists get burned out. They start questioning whether they should even be in this profession. And nobody connects the dots as to what's actually happening. When you sit with someone's pain, when you're genuinely present with their suffering, your nervous system is participating in theirs. You're not just observing, you're feeling it. And you're doing this multiple times a day, every single day, without understanding what's happening or how to protect yourself. Your own nervous system starts to become poorly regulated. You start experiencing hyperarousal. You're on edge. You can't sleep well. You're irritable. You start having intrusive thoughts about your patient's trauma. You feel emotionally numb or detached. You restrict. You pull back from connection because connection feels dangerous. Sound familiar? Well, that's vicarious trauma. And it's not a character flaw. It's not a sign you should leave the profession. It's a sign that you need to understand what's happening and how to regulate your own nervous system. And here's the thing. When you understand trauma, when you understand the mechanism, when you understand what your patients actually need, something shifts. You stop trying to fix their trauma. You stop carrying it. You stop absorbing it. Instead, you become a regulated presence. You ask better questions. You recognize what's in your scope and what isn't. You know when to stay present and when to refer. And that changes everything about your nervous system's experience of the work. You're no longer burning out because you're no longer trying to do something that isn't yours to do. You're doing what is yours to do, creating safety, staying calm, offering genuine connection, helping people find their agency, and giving them hope. That's sustainable. That's actually healing for you too. I want to address another thing that's been bothering me about our profession for a little while. We're told, explicitly told, that when a patient opens up about mental health, we're not supposed to engage with it. We're supposed to refer out, just redirect, don't talk about it. And I understand the intention. We're not therapists. We shouldn't be diagnosing. We shouldn't be treating mental health conditions. Excuse me. But here's what's actually happening. Someone is on your table. They're vulnerable. They're opening up about something that matters to them. And you're essentially saying, that's not my job. Go talk to someone else. That's not staying within scope. That's abandoning scope. Staying within scope means something different. It means you ask good intake questions, not to diagnose, but to understand. It means you recognize when something is beyond what you can help with, and you refer. And it means when someone opens up, you listen. You stay present. You don't try to fix it. You just listen with genuine curiosity. Because here's what happens when you do that. You're not just a massage therapist. You're someone who understands what they're going through. You're someone who gets it. You're someone who isn't afraid to talk about the stuff everyone else is avoiding. And that changes the entire relationship. Because here's what I've realized. Most of the conversation around trauma in our profession is either too clinical or too vague. It's either, here's the neuroscience with no practical application, or it's, be compassionate and refer out with no real understanding of what's happening. What's missing is the bridge. The understanding that connects the research to your actual practice. The clarity that helps you know what to do, what to say, and what to stay out of. That's what I've built my courses around. Not just teaching about trauma, but teaching you how to recognize it, how to understand what your patients actually need, how to stay within your scope, while still being genuinely present, and how to protect your own nervous system in the process. Because here's the truth. You don't need to be a therapist to understand trauma. You just need to understand what it does, what people need, and how your presence, your regulated nervous system, your intentional touch, your genuine curiosity, all becomes part of their healing. And when you understand that, everything changes. Your confidence changes, your ability to help changes, your burnout gets better, and your patients feel genuinely seen and understood. If you're a massage therapist who's felt confused about how to work with trauma, or who's felt the weight of vicarious trauma, or who's been told to just refer out and felt like that wasn't enough, well, this podcast is for you. I actually did a presentation in my membership today on stress versus traumatic stress that outlines exactly what trauma does, what people actually need, and how to show up in a way that's both within your scope and genuinely healing. If you want access to that training and everything else I'm building for therapists who want to understand this stuff, just send me a DM or contact me and I'll get you connected. And if you have questions, reach out. I'm here to help you build a practice that feels sustainable and meaningful. Thanks for listening.